The strike unfolding outside St Thomas's Hospital in London today is not an isolated moment of frustration. It is the culmination of years of growing pressure inside the National Health Service and the latest escalation in a long-running confrontation between resident doctors and the UK government. As thousands of young doctors gather with placards, chants and even pets dressed in protest caps, the message they want the country to hear is simple. The NHS is losing its workforce. And unless action is taken now, the consequences will be felt for an entire generation of patients. This 5-day walkout, the 13th since early 2023, reflects the profound strain on one of Britain's most treasured public institutions. Residents, the doctors in training who keep hospitals running day and night, say they have reached their breaking point. Many describe conditions where emergency departments overflow, where overnight shifts run without adequate staff, and where even fully qualified doctors are being offered wages that fail to keep up with inflation or the cost of living. They argue that they are being pushed out of a system already stretched to its limits. At the heart of their protest is a demand that has been raised repeatedly but still remains unresolved: the restoration of pay to levels that existed before 2008. According to the British Medical Association, doctors at the start of their careers have seen real terms pay fall by nearly a third over the last decade and a half. For a new doctor earning around £18 an hour today, the message is that years of medical study, sleepless nights on the wards and responsibility for patients' lives are being undervalued. The call is not for a raise beyond what they once had, but simply for the return of what was lost. But pay is only one part of the dispute. A deeper frustration lies in the fact that the NHS is turning away thousands of qualified doctors who want to train and serve. Last year alone, nearly 20,000 residents were denied places in training posts. This, doctors say, is not only wasteful but dangerous. In a system already short of staff, rejecting qualified talent only compounds delays, backlogs and unsafe conditions. Doctors on the picket line argue that the government's current approach amounts to a structural failure, one that forces trained clinicians to leave the country or the profession entirely just when they are needed most. As the rain falls on London's iconic riverfront with Big Ben towering in the background, the picket line becomes both a symbol of protest and, in many ways, a portrait of exhaustion. Some doctors carry placards comparing 12-hour A and E waits to humanitarian crises. Others bring their families, insisting that working conditions have become so unsustainable that personal lives are being eroded. Moments of humour appear too, such as a small dog wearing a BMA-branded cap. But even these brief smiles are set against a backdrop of deep worry about the future of healthcare. What makes this strike particularly significant is that doctors say they do not want to be here at all. They describe the act of walking out as painful, even distressing, because it means leaving patients behind. Many say that they entered medicine to care for people, not to stand on picket lines, but they argue that the situation has reached such an extreme that striking is the only way to protect the long-term future of the NHS. If current conditions persist, they warn the UK will face chronic shortages, overcrowding, unsafe wards and an exodus of its brightest young clinicians. One of the most powerful voices on the picket line is Jack Fletcher, the chair of the British Medical Association's Resident Doctors Committee. Speaking through a loudhailer to the crowd, he emphasises that this dispute is not about politics or ideology, but about basic functionality. He explains that a health service cannot survive if it continually turns away the very people it needs to sustain itself. He describes a system where thousands of doctors each year find themselves without jobs or training posts despite high patient demand and overwhelming workloads. And he reiterates the call for Health Minister Wes Streeting to return to negotiations with a credible long-term proposal. Fletcher stresses that the aim is not confrontation but resolution. He says doctors want nothing more than to return to their wards, their clinics and their patients. But they cannot continue working under conditions that leave them burnt out, underpaid and unable to develop as clinicians. He highlights the irony of a system where patients lie in corridors due to shortages, yet trained doctors cannot get employment. It is a scenario that residents describe as both illogical and dangerous. This tension around staffing is echoed by other residents, including those in psychiatry, emergency care and internal medicine. Among them is Adam Aziz, a resident doctor who says today's situation must be understood clearly. Young doctors are not asking for a hike, but for fairness. He illustrates this by comparing their hourly wages to those earned in professions requiring far less training and responsibility. According to Aziz, it is unreasonable to expect highly trained clinicians to remain in the NHS when they can earn more and work under better conditions abroad. The deeper issue, he points out, is that wait times in emergency departments are already reaching record highs, not because of strikes, but because of chronic understaffing. 12-hour waits in A&E have become common even on normal days, and the pressure spills across wards, operating theatres and intensive care units. Aziz warns that if the government fails to increase training posts and retain resident doctors, the crisis will only worsen, leaving patients to bear the brunt of systemic collapse. The concern resonates widely across the healthcare community. Consultants, nurses and support staff have expressed solidarity, acknowledging that every part of the NHS depends on the residents who manage admissions, diagnoses, night shifts and emergency care. Without them, the whole system falters. Many consultants say that today's residents will become tomorrow's specialists, and if the system fails now, the country will face shortages for decades. Across the picket line, conversations reveal a recurring theme. Many doctors feel trapped between their moral responsibility and a working environment that does not allow them to function effectively. Some recount nights when they were the only doctor covering dozens of patients. Others describe how training quality is being diluted because there are too few supervisors, too few resources and too little time for learning. Several residents say they have considered leaving the NHS entirely, notwithstanding joining thousands of colleagues who have already moved to Australia, New Zealand, Canada and the Middle East, countries where pay is higher, hours are regulated and staffing is adequate. As the strike continues, the public response is mixed but largely sympathetic. Many patients, despite experiencing delays, express support for the doctor's demands. They recognise that the crisis is not new and did not begin with this protest. For years, stories of overcrowded hospitals, ambulance queues and backlogged surgeries have dominated headlines. Many patients say they want their doctors treated fairly because the health service they rely on cannot survive without them. However, the government maintains that the residents' demands are unaffordable, warning that large pay restorations could destabilise the public sector. Officials point to difficult economic conditions and argue that they have already offered pay increases. But residents counter that these offers barely address inflation and do not touch the deeper issue, the loss of trainees and the shrinking pipeline of future doctors. They argue that without restoring pay and significantly expanding training posts, no offer will truly resolve the crisis. Analysts warn that the stakes extend far beyond today's picket line. If the dispute drags on, it risks lasting damage to the NHS workforce. Prolonged strikes may further delay elective surgeries, lengthen emergency wait times and erode public confidence. But doctors argue that the alternative, returning to work without any systemic reform, would be far worse. They say that patient safety is already compromised on a daily basis, and continuing down the current path would lead to a silent, continuous crisis rather than brief, disruptive strikes. Throughout the day, the picket line remains energetic with bright signs, chants and a sense of unity. Yet behind this energy lies a sobering reality. The people striking are the same ones who will be working overnight shifts, managing emergencies and caring for vulnerable patients the moment this action ends. Their dedication is not in question. What is in question is how long they can continue under the current conditions and whether the government will act before more doctors leave the profession for good. The scene at St Thomas's Hospital, with Big Ben looming behind the demonstrators has become a powerful image across social media. Young doctors in raincoats and scrubs standing together in defence of a health service they believe is in danger. They want the public to understand that their fight is not only for themselves but for the patients who rely on them. They insist that without change, the NHS will enter a period of decline that will affect every household in the country. As the strike stretches into the week, its significance grows. It is not merely another Labour dispute, it is a confrontation over the future of healthcare. Doctors argue that they have been warning of this crisis for years and that today's walkout is the result of a slow-burning emergency that has now reached its breaking point. They insist that the only solution lies in meaningful negotiation, structural reform and a recognition of the real value that resident doctors bring to the nation. In the end, their appeal is straightforward. Let them work, train and care for patients in a system that supports them rather than pushes them away. The question now is whether the government will respond before the consequences become irreversible.
Now!
What do we want?
Pay restoration!
I know. I was shocked when I
ground like this. So you go to the Honest Resident Doctor Committee at the British Medical Association and responsible for
a resolution and settlement of this deal. My ask is that waste treatment gets back around the table, done potentially for years to come. But if not, we might be back out in the same place. Incredible offer. Thank you all for coming down this morning. Thank you. And action does work. When we call strike action, we don't do it lightly, and turning doctors away from the NHS and restore our pay in a meaningful way.
Jobs.
Patients need doctors. Doctors need
Patients need doctors. Doctors need jobs.
So we're out on strike for two reasons today. The first reason is because we are turning tens of thousands of doctors away from working in our NHS. So last year alone we turned away 20,000 resident doctors from training jobs in our NHS, and on top of that we are asking for restoration of our pay back to what it once was in 2008, and I think that's really important for residents across the country to value them and keep them working in our NHS. More doctors than in the last decade last year decided that they wanted to leave the NHS, and we think that valuing them in a fair way and ensuring that they can get employment and training is a realistic and a reasonable ask for the government. The government have not come forward with any reasonable proposal on either front, and that's why we've been forced back onto the picket lines today. We want to get back around the table, we want to fix this. I don't think any of us find it easy to go on strike. I was supposed to be in work today. I would like to be back in work caring for patients, but sadly when tens of thousands of my colleagues are not going to have jobs next year, we're not just going to stand by idly when we simultaneously have patients being managed in corridors. We think it's a disgrace, and what we're asking for is for West Streeton to come back to the table with a credible offer, and we think that can be reasonable and resolve both of our issues as part of this dispute.
So it's not a pay hike. What we're asking for is our pay to be restored. To put into perspective, a current doctor who just has recently qualified and they're fully qualified doctor, they're currently paid £18 an hour. We're asking for that to increase to £22 an hour. We don't want to be out here on strike, but what we're saying is that we need to increase the number of doctors. The 12-hour waits we're seeing in A&E are happening without the strikes. And if we don't increase the number of training posts and increase the number of jobs for doctors, that's going to continue to get worse.